Thank you so much for that wonderful introduction. I'll go ahead and get started. So yes, I am presenting on investigating the role of PGP peptides and heme and sepsis-related acute lung injury. So sepsis-related acute lung injury is characterized by increased lung permeability and inflammation, and it remains a significant cause of mortality in critically ill patients with limited treatment options available. Someone comes into the ICU with sepsis or septic shock, we put them on a pressor, we try to treat the origin of the infection, such as giving the patient antibiotic, but no real treatment exists, and especially in the later stages of disease. An improved understanding of the immunopathology of sepsis may point to novel treatment strategies. Recent studies show that products of hemolysis, such as plasma-free hemoglobin and heme, are increased in sepsis. Moreover, our own studies have shown that proline, glycine, proline, PGP peptides, which are bioactive fragments derived from extracellular matrix proteins known as matrikines, are increased in human and murine models of sepsis. Notably, these PGP matrikines have been shown to promote lung leak through CXCR2 activation, which is a chemokine receptor involved in neutrophil recruitment and activation. So the objective of our study was to investigate the interrelationship between PGP and hemolysis and human sepsis. This is a prospective observational cohort study. So for the last 2 years, from June of 2021 to May of 2023, I have been recruiting patients for the study. I screen the ICUs every single morning at the University of Alabama at Birmingham, or UAB Hospital. And our sepsis and septic shock patients are enrolled within 24 hours of diagnosis. Our healthy controls and our ICU controls come from the Lung Health Center predominantly. We collect blood, plasma separated by centrifusion, and plasma-free hemoglobin and heme are measured by spectral deconvolution. Haptoglobin and hemopexin are measured with ELISA, and PGP is measured by mass spec. So if you direct your attention to table 1 in the bottom left-hand corner of the screen, you can see our patient population. We have recruited 35 healthy controls, 38 non-sepsis ICU controls, 20 severe sepsis patients, and 47 patients with septic shock. Overall, we have a pretty homogeneous patient population among each group. If you now direct your attention to figure 1 towards the top of the screen, you can see levels of haptoglobin, hemopexin, and PGP were measured in all of our recruited patients. We observed that plasma haptoglobin levels increased with illness severity, with the lowest levels in our healthy controls and higher levels in our severe sepsis patients, while plasma hemopexin decreased with illness severity. We also observed the total plasma PGP count increased with illness severity. So looking slightly further down the screen at figure 2, we analyzed plasma haptoglobin levels in relation to PGP levels. No significant relationship was observed, suggesting that haptoglobin is less likely a regulator of PGP-mediated acute lung injury. Lastly, looking at figure 3 in the top right-hand corner of the screen, we analyzed plasma hemopexin levels in relation to PGP levels and observed an inverse relationship between the two. So in conclusion, we really demonstrated a significant relationship and the severity of sepsis and the levels of PGP, haptoglobin, and hemopexin. And we also discovered that as plasma hemopexin declines, free heme, this suggests that free heme could be a regulator and that hemopexin scavenges free heme and may influence PGP, acute lung inflammation. And this also suggests that PGP can serve as a biomarker for the progression of sepsis. And we do have ongoing studies right now. This is a continual study funded by the NIH. We're still recruiting patients, and our goal, long-term is to really continue to analyze this molecular pathway and hopefully in the future kind of develop a therapeutic, a novel therapeutic, a drug to target these later end stages of sepsis. So this is my gap year research, kind of sentimental. I've been working on this for 2.5 years, and that concludes my presentation, and happy to answer any questions.
Great, thank you so much. So you noted that you were kind of looking into kind of going after this therapeutically. Is there anything out there right now that targets these PGP peptides, or would this be completely novel, completely new?
This would be novel, and so we honestly wouldn't exactly target the PGP peptides themselves. We're really looking at how heme influences PGP peptides, and kind of that's where the gap of knowledge is. And it's kind of our proposition is that heme influences PGP through proteolytic cleavage through proteases. So I would imagine that it would be some sort of protease inhibitor targeting the pathway.
And have you seen patients that have higher levels, are they doing worse? Or is it really just because their classification, their sepsis classification? Like, have you seen the patients with, like higher levels of what you measured, doing significantly worse?
Right. So actually, I can't exactly answer that. So when we measure all of these, the patients are kind of blinded to the lab. So I have not myself looked at these levels and the specific patients and their outcome. We have, of course, recorded like 30-day mortality, 30-day ICU length of stay, things of that nature.